Good evening, everyone. I'm Clarice Redding Lewis, Chief Recovery Community Officer at Hanley Foundation, where our mission is to eliminate addiction through prevention, advocacy, and recovery support. Thank you for joining us for week 4 of our Recovery Leadership Institute's Summer Recovery Leadership Series. Tonight, we will be welcoming Dr. John Dyben from Origins Behavioral Healthcare. Please remember to drop your questions into the chat. There will be a moderated Q&A following tonight's session. Our topic for this evening is stigma reduction. Please join me in welcoming Dr. John Dyben. Dr. Dyben, with his multifaceted experience and leadership in the substance use disorder and treatment field, he has a varied skill set, including counselor, clinical manager, teacher, pastor, and respected expert. As Chief Clinical Officer, Dr. Dyben provides supervisory and clinical oversight to all Origins Behavioral Health Care's programs. Dr. Dyben continually builds upon experience as an academic through research and nationwide speaking engagements, covering the topics of addiction, spirituality, and other related items. Dr. Dyben holds a bachelor's in psychology, a master's in conflict management, a master's in management, and a doctorate in health science. He has completed postgraduate studies in psychology, philosophy, and religion. Dr. Dyben is a master's certified addictions professional, a certified mental health professional in Florida, an internationally certified alcohol and drug counselor, and a substance abuse professional. Dr. Dyben is also a musician, a writer, and a private pilot. In his free time, he enjoys being with family. Thank you for joining us this evening, Dr. Dyben.
Thank you so much. I'm going to share my screen with everybody, and thank you all for being here. This topic is one of great importance, and some of you are really familiar with it and really touched by it in a lot of different ways, and some are less familiar with it. But I'd like to start by talking about the fact that we're all aware that today in our nation, we have been dealing with an epidemic of overdose deaths. Tens of thousands die every year from things that are secondary to addiction. And we now have these institutions and these great big scientific organizations, the National Institute on Drug Abuse, the American Society of Addiction Medicine. We have top scientists that are putting energy into understanding addiction, understanding it, all the science and the neurology and all of the big scientific aspects of it so that we can treat it better. And one thing that they're saying again and again, in fact, Nora Volkov, who is one of the top addiction scientists in the country, I would argue in the world, just recently wrote a piece, maybe some of you have read it, about the importance of addressing stigma. The American Society of Addiction Medicine says it's so important that for anybody, whether it's a person or an organization, to be certified by them, they not only have to be able to show that they understand the neurology and that they understand how drugs work and they understand addiction, but they very specifically have to understand and be able to address stigma. What I hope you'll walk away from tonight is a good understanding of what we mean by stigma. What are the dynamics of stigma? What is it? And also, why is it such a weighty, important subject for us to address? And then hopefully you'll walk away with better ways to address it and even look at least one other condition where we've addressed it to a degree and it's made a big difference. So that's what I hope that we'll do tonight. And again, I'm so grateful for you all to be here because this topic literally is life or death for tens of thousands of people. So let's get right into it. Let's talk about What do we mean when we're talking about stigma? Well, stigma isn't just one thing. It's kind of a lot like people use the illustration of an iceberg, and they say, you know, what you actually see is only the smallest part of it. And stigma is like that. Stigma has three kind of elements to it: beliefs, attitudes, and then words and actions. The addiction stigma research team, which again, this is a group of scientists that are really looking to understand it. They label these things as stereotypes, prejudice, and discrimination. And the words and action, the discrimination, that's what we see. That's what the tip of the iceberg is. But the real foundation of stigma is in beliefs. And so when we talk about stigma and addiction, what we're talking about is negative beliefs about individuals and groups who are categorized as being somehow part of any condition. And that we're going to talk about addiction tonight, but that's true of any condition. You can think of some big global conditions. Think of things like poverty. So what someone believes about poverty and what someone believes about impoverished people impacts their attitudes towards those people. And it can, if it's a negative belief, a negative stereotype, it can cause the attitude to be a negative prejudgment. And if our thoughts and our beliefs and our feelings about a group or individuals are negative, then our words and our actions will tend to be as well. And that's what we mean by discrimination. And so today, more than anything, I want to talk about our beliefs. And in fact, I want you to stop for a minute, and I'm going to ask you just to take a minute and to ask what you believe about some things. I mentioned poverty, war, crime. These are all social issues that we tend to have beliefs about. So when it comes to poverty, if I believe that poverty is the result of laziness and people just not working hard enough, and if you work hard enough, you can get out of poverty, then I may have an attitude towards impoverished people that says they just don't work hard enough. I might have a negative prejudice. And in fact, my words and actions, my words may be belittling, they may be ignoring, they may be inflammatory against any type of anyone that would try to change the system or help those people. And my actions are not going to be anything that's going to build them up. That's what we mean when we're talking about stigma. But let's say on the other end, somebody believes about poverty that what do you believe about poverty? Well, I think that poverty is actually a social issue. It's a social construct, and it's something that we're all responsible for. And in fact, some people are impoverished, and it's because, at least to some significant degree, by the social constructs within which they were born. And so I'm going to have a different attitude towards them. I might actually see them, rather than seeing them as just lazy people or people who won't work hard, I might see the impoverished as people who are stuck in a system. And then my words and my actions would be advocacy to change and improve the system. So what we believe about these big things, and it's true about crime and true about war, what we believe about these things really makes a big difference in how we feel about them, and then what we individually and as a society do about them. So let's think about let's bring it down. Let's talk about some healthcare or some health concerns people might have. What do you believe about diabetes? Just take a minute. What do you believe about it? Have you even ever thought about that? Maybe, maybe not, but probably you've been exposed to diabetes at some point in your life. You know someone who has it, or you may have had it yourself. What do you believe about it? What do you believe about cancer? What do you believe about AIDS? What do you believe about dracunculiasis? Now, for some, that last one in particular is one that you're not familiar with. Some of you are, some of you have never heard of it. Probably everybody has heard about diabetes and cancer and AIDS. But thinking about what you believe about those things is important because it's going to determine, it's going to influence your attitudes and then your actions. And that's true of us as a society as well. If we look at this, this is not any new phenomenon, right? If you look back in history, let's go way back. Let's go back to the 14th century and think about a health problem that existed, the plague. And we've all heard about it or read about it. And so you're in the 14th century and all of a sudden people are getting very sick and they're having this terrible illness and they're dying and it's spreading. And the prevailing belief, because nobody knew why it was happening for quite some time, and it seemed supernatural. And so the prevailing belief was this is a punishment from God. Someone or someone's have done something bad, and so we're being punished by God. And that prevailing belief caused the result of it caused words and behaviors, right? And the behaviors were we root out people who might be deemed sinful in order to kind of get God's favor back. Wasn't super effective. But thinking about mental illness, and let's go back again in time, not quite so far back, but go to the 16th century. Thinking about mental illness. What was the prevailing belief about mental illness? Well, there were really kind of two camps. Either it was demon possession or you were just a moral defect. You were just broken and there was nothing that could be done. And so if someone had mental illness, they would try exorcism. Let's see if we can get some demons out of this person. And then if that doesn't work, well, then they're just morally defective. Our attitude towards them is they barely even deserve to live. And so they would just be locked up in terrible conditions. What we believe about social conditions, societal conditions, and even health conditions dramatically impacts how we individually address it, but also how we as a society address it. Now, eventually, society to some degree, of course, when it comes to mental illness, there still is a lot of negative stigma associated with it, but it's wildly, vastly improved over time. Why? Because we've learned some things about both the plague and about mental illness. One is that we learned that we could actually understand it if we researched it. That it wasn't a magical mystery, but it was something that if we researched and worked to understand, that we could actually improve our understanding. Secondly, we came to believe that it wasn't of supernatural design. This is not something, the wrath of God that's upon us. Thirdly, we came to recognize that it's not moral failing. Whether it's plague or mental illness, it is not a matter of moral failing. And most significantly, we came to believe as a society that these things were treatable. Now, today, there's still tremendous stigma around mental illness. A lot of people still have very negative beliefs. But like we said, as a society, we have come to a much different place and making a lot of progress and understanding that these four things are true about mental illness and also plague. I don't know if people realize the plague still exists. It's not eradicated from the world. There was an outbreak in Madagascar a few years ago, but we know now that we can treat it with antibiotics. So our beliefs led us to research, led us to see these things differently, and it changed the world. Changed the world. It's a big phrase, but I really believe that. Those of you that are out there who have either struggled with mental illness or know or love people who do, which I doubt there's anyone on here who hasn't been touched by it, you know that the power of how people treat those who are struggling with mental conditions it has a dramatic impact on them as individuals and all those who love them. So thinking about that and thinking about these four really, really important things that we come to understand, that we can understand things better through research, that a condition is not of supernatural design, that it's not a matter of moral failing, that it's treatable, we begin to do work to help improve the condition. So thinking then about addiction, what do we do here in our country? What's the tip of the iceberg? What are our actual, what's the actions? Well, since the 1950s and really 60s, it's been not the same as what we see for other conditions. So when we learn these four things, right, what do? Now we demand that there be resources and treatment for and research. We build facilities to care for people afflicted with conditions. We demand high standards of care. We have walks and fundraisers and ribbons and special days and public awareness campaigns. All of these things are really critical when we believe those four things. But like I said, addictions actually tends to be a little different historically, certainly over the past decades since the 60s and the beginning of the quote unquote war on drugs. What do we have? The reality is right now we have, and this is 2015 numbers, so we have even more federal prisoners. We are locking up people by the tens of thousands for nonviolent, non-trafficking drug offenses. We lock them up, and that has increased dramatically over the years. Health insurance does everything they can not to pay for treatment beyond the absolute bare minimum that they can by the law. There was a Pew study a while ago. There was a study by a man named Barry, and what they found was that people with addiction were among the most strongly negatively stigmatized groups in the world. In fact, people said that they were more likely to have negative attitudes towards those suffering from drug addiction than those with mental illness. And we know that those with mental illness have a tremendous stigma issue. But here's the key: because of that belief, they overwhelmingly did not support policies that help those who are struggling with addiction. And so what happens? The result is, if we believe that addiction is a moral choice, if we believe that it is in the control of the individual, if we talk about addiction being a disease, but we don't as a society really believe that, what do? We focus on incarceration instead of treatment. We focus on punishment instead of care. We focused on arrests instead of research. And that's where we have been for decades. So what's the result? We started a war on drugs to stop this scourge, and we focus on incarceration, punishment, and arrest. And the result is today that more people are addicted, more drugs are in our country. Drug overdose is now the leading cause of accidental death in the United States since 2016. So stigma has been a huge driver in the problem just getting worse and worse and worse. So what do? It is a tremendous societal burden, and it's a tremendous heartbreak for those who are near it. And the reality is that more and more, nobody's not near it. So as a health scientist, when I am asked this question, or when I'm struggling with a question of how do we turn the tide, because things are getting worse and worse and worse. I like to see if there are any analogs, right? Are there other conditions where there's been similar problems and similar societal stigma, and the tide's been turned? And when I think about addiction, the best analog that I have for recent time, I think, is looking at what has happened over the past several decades with AIDS. So I want you to think about AIDS, and I have no idea how old anybody is, but I certainly remember the first time I ever heard about AIDS in the 1980s. I could actually, it's so vivid that I remember the room I was in. I was young. I remember the room I was in. I remember the TV, and it was this big, and it was fuzzy, and it was a news program, and I can see AIDS, and they begin talking about this really scary new disease. And I remember it so well, partially because it was scary. I was frightened. And there was tremendous negative stigma in our nation. There was a lot of misinformation, but there was, even without the misinformation, we're talking about the 1980s. And part of the driver of the stigma was the fact that this was mostly gay men. And in the 80s, it was still a large part of our culture, still saw the LGBTQ community, which, by the way, is a word and a descriptor that no one ever used or talked like that at all. And they still saw them as morally wrong in what they were doing, and in being who they were. And that stigma and that judgment was much more widely accepted in our nation at the time. Homophobia was, I would say, probably the norm, not probably, definitely the norm above acceptance of people. And so when we start seeing this happen, the people who had the condition were blamed. It's all your fault. And not only were they blamed, but there was tremendous resistance to doing anything about it. People were, their healthcare professionals did not want to treat those with AIDS. The society in general, our communities, didn't want to fund research for AIDS. We had, as a society, such a negative belief, and that drove our desire to just kind of marginalize, to put people to the side. So think about beliefs, attitudes, and then words and actions when it comes to that moment in time. So what was the stigma? What did people believe about AIDS? Well, they believed things like, you asked for it. It's your fault. If you didn't have sex, you wouldn't have AIDS. In fact, there were a lot of people out there saying you deserve it even. There were even many people saying it's punishment from God. So if that was the prevailing societal belief to some degree, what was the prevailing attitude? It was disgust, disdain. And so what were the actions, the words? The actions were marginalizing. When we're talking about marginalizing, we're talking about putting people aside and saying your needs are irrelevant. We don't want to think of ourselves as people who do that, but that was certainly what we saw in that time in the 1980s, and for quite some time. When people would think about those with AIDS, it was very much a they, them, those people. So what the heck can you do to turn that around? Well, in the course of conditions like this, and AIDS is not the only one, but I think it's the closest way to understand it. Something tends to happen in history. I call it the pivot point. And with AIDS, at some point, people who were not reviled by society, people who were seen as seen in a more positive light in society, also began contracting this. And then family members of people who had big voices and power began contracting this. And this is what happens. The pivot point is when a condition spreads to a point that it moves beyond those people and it starts touching other people, starts touching those that have the stigma, and they begin to have a crisis. And that happened, and something began to change. And there were more things that caused this change, but this pivot point tends to happen when the marginalized group and what they're struggling with, when their struggles, whether the health condition or any other struggle, begins to impact everybody else, and they begin to recognize it's not just them, but this is something that we all have to deal with. And so through advocacy that begins to happen at this pivot point. And I want to say that advocacy, when I'm talking about advocacy, I'm not just talking about advocacy from people in the marginalized group. For this phenomena of turning the tide to happen, there has to be people in the marginalized group who are standing up and advocating, but there also has to be advocacy from people outside of that marginalized group. Those allies, those people that join. When you look at this phenomena again and again and again, you'll see that it is the joining of those within the group and without that make that big difference. And so what began to happen? Well, people began to get educated, and beliefs got challenged, and as a society we could begin to recognize that the reality is no one chooses a disease, and most diseases, many diseases, if not most, all have some sort of behavioral component. The diseases that we were looking at before, diabetes, cancer, dracunculiasis, all of these can have behavioral components. Both of my parents were diagnosed with type 2 diabetes, and there is they never asked for that. And part of that was completely out of their control. And yet diet and the way they live their life influences that condition. If somebody has, I remember a politician talking about his mother who was a smoker having cancer. And we still recognize cancer as a disease and as a condition that meets all those other 4 requirements or criteria, and we treat it. When we began to change that belief and help people recognize that it's nobody chooses this, then we can change attitudes and we can move from disgust to compassion. And when we have compassion, how do we act? Well, we, instead of marginalizing, we seek to protect, to treat, to research, to better understand it, and to help people who are struggling with that condition. And so the result is fascinating. The result is that somewhere in the early 2000s, we began to see a worldwide decline in new AIDS cases, and an even greater decline in deaths. We began to see a tremendous amount of research going into new medicines and things that have come so incredibly far that there are people who are HIV positive, the precursor to A, full-blown AIDS, that are now have levels that are undetectable. Their AIDS was a death sentence, and now it's not. It doesn't mean that we're done. It doesn't mean that stigma no longer exists. And in different parts of the country and in different parts of the world, it's at different levels. But being able to turn the tide only happened when people and society as a whole began to change and adapt new beliefs. This is what has to happen with addiction. So I want to go back to this for a second. Beliefs, attitudes, words, and actions. What do we as a society believe about addiction? Historically, our behavior has shown us that we believe some of the same things that people believed about AIDS. It's your fault. You chose this. Nobody forced you to drink alcohol. Nobody forced you to use drugs. And it's as if somebody intended to develop this terrible disease of addiction. I can tell you right now that no one ever chose any chronic disease. Absolutely, we all have responsibility for making choices in our lives. And we all do make silly, wrong, bad choices, smart choices, not smart choices. At the end of the day, though, addiction is something that totally takes an individual over, and it removes from them their ability to choose to stop. That's what this disease does. And so when people believe things like it's your fault, or if you really loved me, if you really loved your family, you would stop. If you have the choice, you have the ability to stop, and you choose not to. When that's the belief, the attitude similarly is disgust, anger, resentment. And our words and actions, we say very comfortable being completely disparaging about people with addiction. We are comfortable as a society with, we talk about, when I think about memes and I think about things that people find funny and they post, we don't have any problem with mocking people who struggle with addiction. And our actions back up those attitudes as well. So in our nation, a lot has changed in the past 10 to 15 years. More work than ever has been done to reduce stigma, to understand addiction. But we are still in a place where we have not yet made that turn, that pivot, where we've not yet made that turn, turned the tide. We have hit a big pivot moment in that, and probably around 2016, we started seeing this more than anything, is that famous people, politicians, people who were up to this moment would have said that, addiction and overdose and death from that is for those people. It is crept into every area of our lives. And so I believe that we are potentially at that pivot point where we can come back 10 years from now and look at a graph and we can see that we've turned the tide. But to do that, we have to individually and societally look at our beliefs and attitudes and our words and actions. And so I would ask you to step back for a second. Again, I know I've asked it a few times. And I want you to know that what I ask you to do, I do myself. And I want you to think about addiction. And I want you to ask yourself, what do I presently, right here, right now, what do I presently believe about addiction? What do I believe about people who are suffering with addiction? Do I even think of it that way? And the reason I say presently is because our beliefs and our resulting attitudes, they're often things that are unconscious. They're often things that creep in. And so I think we have to do this all the time, again and again. What do I believe about addiction? How do I feel about people who are addicted or suffering with some sort of substance use disorder? And this is not only what we have to do individually, but it's what we have to do societally. We have to confront honestly our beliefs. We have to create forums where we can say, this is what I believe, because then we can look at how that influences our attitudes, and then we can make education worth something. So one of the first steps, so I'm so grateful to you for being here. I'm so grateful to the foundation for doing this, is because educating people is a critical part of changing beliefs. But as you're looking at your own beliefs, I encourage you to have compassion for yourself. And when you have conversations with other people, and you hear them saying things that reflect beliefs about addiction that might not be true, or that might not be right, that might be damaging, I encourage you to approach them with compassion too. We're all familiar of what it's like living in our nation, in our world today, and there are many sides and many issues, and people butting heads and trying to say, as soon as I hear someone say something that I don't agree with, or something that maybe I even know is wrong, I'm going to let them know, I'm going to educate them, and I'm going to butt heads with them. And here's the deal: wrong beliefs, harmful beliefs, should never be ignored and should always be addressed. But my experience is, most of the time when we have negative stigma that is aimed at an individual or a group, let's just talk about people with addiction, it's not because we're evil people. Most of the time it's either because I just have never been educated, I don't know, or it's because I've been hurt, and it impacts me personally. So if we're going to reduce stigma, first of all, we have to look at our own beliefs and attitudes. We have to have dialogue in our communities about others' beliefs and attitudes. We have to have it with compassion and openness to hear each other. And in that environment, education, helping to explain what addiction really is, what is really happening. I'll never forget, I was speaking to a state group of social workers. There's the Florida Association of Clinical Social Workers. And this particular, there were about 400 or 500 people at this talk. And the talk I gave was on the neurobiology of addiction. And it was a simple explanation of what is happening when we say addiction is a disease, what's actually happening in the brain. And so I explained why it is that a person who's in the midst of addiction truly does not have the ability to stop. And a clinical social worker, this is somebody who's been in the field of mental health for many, many years. She said, I wish I heard this talk a long time ago. And because I got married about 30 years ago, and my husband was wonderful, and we had 2 great kids, and he was great. And we all drank, everybody drank. It was something that was normal. Nobody had a problem. But at some point, my husband's drinking became problematic. And so much so that he just couldn't seem to stop, or he wouldn't stop. And at some point, we divorced over this. And he actually drank he actually died of alcoholism. And his kids, who are now adults, have been wondering for the past 10 years, why did Dad choose the bottle over me? And it's only now that, because I thought the same thing, why did my husband that I love choose the bottle over me? And it's only this moment that I realized he didn't. He didn't. He had a disease that, left untreated, made it impossible for him to make any other choices. That education makes a tremendous difference when we create that environment where it's open, compassionate, and we listen to each other. Finally, our words and our actions. Advocacy humanizes people. Remember dracunculiasis? Dracunculiasis was actually a disease that afflicted millions and millions of people in third world countries every single year. And you can look it up, it doesn't matter, but what matters is that it was tremendously, people died from it, but even more commonly, people's quality of life was just annihilated by it. And it went on for, we don't even know how long. And it wasn't until the late 1980s that a guy named Jimmy Carter and his wife, President and Mrs. Carter, got a trip to Africa, and they were actually introduced to people, and they saw people, the faces and the experiences of people who were suffering from this thing, guinea worm disease, another name for it. And they were so moved by it that they said, we are going to do something about this. And today, where there were typically tens of millions of new cases every year, today, the last I heard was that there were about 21 new cases in the entire world. It's eradicated. It doesn't even exist anymore. But that would never have happened if we weren't able to humanize those people. And so for those who are in recovery in those movements where people talk about their stories, I just applaud that for the work that the foundation is doing to put a human face on addiction and recovery. It's critical. Finally, and I want to talk more about that, but I want to be conscious of time. If we want to reduce stigma, we have to be impeccable with our words. What we say, the words we use matters. So I don't talk about treating clients. I talk about treating patients. That language in any organization that I'm responsible for, we talk very intentionally about the fact that we treat patients, because a patient is a person who is seeking care for a health care condition. These are not people seeking moral reparation, but they're seeking health care. I use terms like people suffering from addiction, people with a substance use disorder. I stay away from things like addict, junkie, crackhead. Crackhead is one that is so common. It's a punchline. We use it as a joke. And I think that contributes to continuing stigma. When people have drug tests even, we talk about positive tests and negative tests rather than terms like clean or dirty. There's so much more, and my encouragement to you would be to do a little research, to look this up, and to ask people who are in this community, what are our words that we use that hurt and that stigmatize, and seek to move away from that. And this is not about political correctness. I want to end on this, that being impeccable with my words and being careful to avoid words and terminology that stigmatizes people. It's not about being politically correct. Political correctness is about me trying to figure out how to say the thing that's going to make the most people like me. Being impeccable with my words and avoiding words that are stigmatizing, avoiding words that put that negative light, is me being intentional with the fact that words matter and they have power. And I will be intentional to do all I can to use the power that I have for good and not for harm. So we're out of time. I know that we've probably got to come back and have some Q&A, and I invite and would be thrilled to have answer any questions that anybody has.
Thank you so much, Dr. Dyben. That was so informative, and that was a lot of helpful information. So right now we are going to ask a few questions from our chat. Our audience has been very vocal, and I want to thank everyone for their participation. We will try our best to get through all of the questions, being mindful of time. So our first question, Dr. Dyben, how has medically assisted treatment and harm reduction impacted abstinence-based treatment models?
I am so glad somebody asked that question. I think that this is even within the substance abuse treatment, the substance use disorder treatment community, there are stigmatized groups. And one is it's almost, I hate to, there's not enough time to give this full answer, but let me clarify one thing real quick. Medication assisted treatment is not one single thing, right? There are several different types, and the type that is most probably historically vilified by abstinence only treatment providers, which I am, right? So that's what I do. My goal is to help people achieve abstinence. However, historically, people who do the kind of work that I do have had a very negative view. Their beliefs about people who are doing methadone maintenance or Suboxone work are that they just want to keep people addicted to drugs, and what they're doing is awful. And on the other hand, there are people who will, in that kind of camp, who will look at those who do what I do and say, that abstinence-based treatment is never going to work, and you guys are just going to cause people to die if you don't, use. I reject any polarization or politicization of anybody who is trying to treat and trying to help people with substance use disorders. So I think there has been the same polarization, there's been fighting, but the idea that one harms the other, or that one is good and one is bad, though I have a preference, though I have an expertise, and though I have an area that I work in, I think it's important for those of us who are involved in any kind of work to help this condition to say this: if you are truly doing work to help people with addiction to improve this condition, then you and I are on the same team. So this is one that we could have a whole lot of talk about it. But I think it's really, really important. And I encourage people, whichever camp you're in, if you're in that abstinence camp, if you're in that Suboxone or methadone or any type of maintenance camp, that we stop polarization, that we absolutely just refuse to be bearers of any stigma, and that we recognize that we are on the same page, trying to achieve the same thing, though through different means.
Awesome. Thank you so much for that answer. This next question, we're going to switch gears just a little bit. We wanted to really kind of dive deep into the stigma that individuals face when they may have a child or family member who is struggling with behavioral health or with substance use disorder. Often these individuals are viewed through a behavioral lens as well. There may be the stigma that they are bad parents, or that they were not attentive enough or not caring enough. These parents might become cut off from their network and left in isolation while their child is struggling. How can we address the stigma in the community when it comes to parents struggling with children who may be suffering with substance use disorder?
That is such a beautiful question, and it's right on. I remember hearing a wonderful psychologist from the South Florida area talk about the difference between someone who is hospitalized for an addiction or a mental health disorder as opposed to someone who has a child hospitalized for another condition. And she called it the casserole. She said the difference is the casserole. The person whose child's in the hospital for another condition, people are bringing them over casseroles every night, calling them, making sure they're okay. If your child has been Baker acted or Marchman acted or is in treatment for addiction or mental health disorder, those casseroles don't come flowing in. And I think that the answer, there's several things, but I think one is the answer is the same, that we do those same things. We examine our beliefs and our attitudes, that with an attitude of openness and compassion, we challenge beliefs and attitudes that are unhealthy and that are not right and not true. And also we do those same things with watching our language and our stigmatizing language, and we educate the public. But the other thing is, right now, there is every week, I'm involved with a parent support group. So one of the biggest things is peer support. When the support group that I'm part of, it's happening right now. Someone else is actually doing it for me. Parents and family members who have loved ones in treatment are gathered together on Zoom. And there are also groups like Al-Anon that are incredibly helpful at providing support, because the biggest sad thing, and I speak this to say this as a parent who has had a child in treatment, the being alone in your head with all of those things, because I can assure you that every parent struggles with those same things. Every parent says, yeah, clearly I must not be a good parent. Where did I go wrong? And so helping them by providing them with others who have been through it and have going through it, as well as the same principles that we've talked about with turning the tide of stigma about addiction as a whole.
Thank you. And so, in that same vein of family, we do have another question. And that question is, how do I talk to older people like my parents or grandparents who are so set in their ways, who believe that substance use disorder is all about willpower?
Right. And that is, it's generational, but also it is pervasive in a lot of cultures. And I think the key is to speak truth in love. And that's very different from what we're doing in our society right now. How do how do I get my parents, who are definitely both my parents are still alive, and we have, my dad is a scientist, and he and I, he's a great guy, and man, he and I sometimes, though, we disagree on certain issues, especially certain social issues. And my temptation, and certainly his temptation as well, is to just batter each other with facts and to just challenge. And I've never found that to really work on an individual level. But what works is when I say, Dad, I really appreciate, I hear what you're saying, and maybe even reflect back, and I will ask questions. I'd encourage whoever wrote that, I'd encourage them to ask questions for more time than you give answers, and ask, where does that belief come from? And because someone may have there may be a lot of really great cultural reasons why they think you can overcome anything. And then when people are listened to, they are far more likely to listen. And so I would ask questions, and then I would say, I heard this guy talk about this, and can I tell you what he said, and tell me what you think about it. You're much more likely to get an openness to that. Unfortunately, I know that's not what we're doing much in our society, but that we've got to change it if we're going to make any real difference.
Okay, speaking of change, so our next question. There are many people who are citing the fact that we now have hundreds of thousands of people here in America in long term recovery, but they remain anonymous. They go through these anonymous programs, they don't talk about or share their experiences, but there are a group of people who believe that these experiences should be publicized. We have doctors, lawyers, mental health professionals, athletes, and sports coaches, all of whom are in long term recovery and could really be an inspiration to those around them. What are your thoughts about encouraging these individuals, especially those who are high profile in long term recovery, kind of shed that anonymity and share their story?
It's funny. Years and years ago, I thought differently about anonymity. If you'd asked me 15 years ago, I had this idea like that it was a crucial part of long-term recovery, and I think that we started to see, and there are several groups now that are organizing people in long-term recovery and short-term recovery to get their faces and voices heard. It's one of those groups. And what I would say is each individual's story is, your story is sacred. Every one of us who has struggled through something has a gift that we can, that's a gift, and we can do something with that gift. At the same time, it's a sacred thing for each individual. And so when I'm asked, and I have many, many times been asked that question by people, should I share my story? And when people want to, I encourage them, and when they're ready to. But the reality is, as with anything, think of some of the inspirational stories you've heard from people who've experienced other types of tragedies. I can think of people who've experienced terrible things that were eventually able to really make something powerful, a gift for others. But I never would want to push someone or to tell them that they should now. So I think when people in long-term recovery when people in recovery, when people tell their stories, when people brand new to it, tell their stories, get out there, I think that there is a power to that. But I also think it's very important to be respectful to anyone and let them decide when they're ready to share about their own struggles.
Thank you so much for sharing your thoughts surrounding that. So, our next question, this really sort of applies to those who are in the medical field. So, what should healthcare providers do if they realize that they may have a bias towards individuals with substance use disorder and they find themselves treating them differently? How do you advise these healthcare providers to address this stigma with their colleagues or their staff? And is there some type of stigma awareness training or education that you would suggest for them?
So I actually do that with health professionals. I do it with physicians and nurses. In fact, there's a local hospital that a few years ago, their nurses in particular, and nurse practitioners, were having this struggle, and they were saying, I don't like working with the addict, right? And that was the terminology. And these were not bad people. These were wonderful people, dedicated their lives to helping others. And they were smart people. They were nurses, but they just couldn't seem to, they didn't like them, and they treated them differently. And so what happened was someone else began to notice this, right? And said, we've got to address this. And what we did is we began to create opportunities for them to talk with each other, but also mediated by someone who really, really understood addiction and what was happening. And so what we found is that they are constantly, they're constantly telling me what to do. They're being rude, and until the nurses and the doctors, until they got the education to understand what was happening with addiction. See, people think that medical professionals are trained in addiction, and that's not true. And so when they begin to understand, when I first got to this one training, I said, what do you want to get out of this? And they said, we want you to tell us how to, I don't have any sound on you. I'll keep talking.
That's fine. Thank you. But so there's a follow-up question to that. Do you feel that these trainings, or have you seen just in the years that you've been providing these trainings, do you feel that these have really made an impact? Have they been helpful? Have they sort of helped end the stigma in the healthcare world? What is your opinion?
No training is helpful long-term without ongoing follow through and supervision around it. And so I have absolutely seen enormous differences. Now I have seen, I've done trainings with physicians, and I've seen physicians change their practice based on their understandings. But when a training on stigma is followed up with ongoing regular times where people can talk about it and people can be reminded about it, that's when the change really happens. So absolutely, training can make a gigantic difference, but it's got to be followed up with ongoing supervision around the issue.
Awesome. Thank you. So, Dr. Dyben, this has been so wonderful. We do have one last question. I will go ahead and give that to you now. Our participant says, when I can explain the notion of the hijacked brain to clients, they are stopped dead in their tracks. How do we explain that concept in these different meetings and workshops and trainings that we are having?
Well, I think you do. One of the things is the same way. I mean, you provide opportunity. If it's important enough, we will provide opportunity to explain the hijacked brain, to explain the neurobiology of addiction. It sounds really big, but the reality is it's a really simple set of concepts that can be life-changing. So I think we have to say to each other and to ourselves that getting this message out is important enough to dedicate the time.
Thank you so much, Dr. Dyben. I think this has just been such a wonderful discussion. And for everyone who has participated, thank you for dropping your questions into the chat and just for all of the conversation we've been able to have. And I just want to remind everyone that this is only week 4 of our series. We have 3 more parts to go. And we'd like to just take time to thank Dr. Dyben and the team over at Origins Behavioral Healthcare just for giving us all of this information. And for those of you who may have logged on late or were not able to catch the entire presentation, no worries. The entire series will be available in our video library online after September 1st. I'd like to thank everyone for joining us tonight for the Recovery Leadership Institute. And also to remind you, we will be back next Wednesday live from the Palm Beach County Hub. And we'll be featuring Marcia Martino from NAMI speaking on co-occurring disorders. So once again, thank you everyone and have a wonderful evening.